We are here with this. We are moving into the post-lunch session. We are here with the session which is considered as a need of the hour. Media during the pandemic and its impact on mental health by Dr. K.S. Pavitra. We have Dr. Savita Malhotra and Dr. R. Indumati to chair the session. I welcome the chairperson to take the stage. I welcome the chairpersons to take the dais. As we are running out of time, I welcome Dr. K.S. Pavitra to take the dais. Dr. Savita Malhotra. Dr. Savita Malhotra, one of the best psychiatrists in Mohali, Punjab, with an experience of 42 years in this field, retired from Pejimar, Chandigarh on 31st/1/2016 as a Dean, Pejimar, and a Professor and Head Department of Psychiatry after 42 years of continuous service. She is known internationally and nationally for academic excellence in psychiatry and child and adolescent psychiatry. She has been a teacher to students of MD, PhD in psychiatry and DM in child and adolescent psychiatry. Dr. Indumati, DPM from Madras Medical College, DNB from Atma Hospitals, worked as a senior resident in the Department of Psychiatry, Jipmar, Pondicherry. She specializes in perinatal psychiatry. Currently, she is a member of IPS Samanvi. I welcome you all, ma'am.
Kind attention. Shall we start the session? Media in pandemic.
I request everyone to take your seats as the session is yet. We are starting the session.
So, good afternoon, one and all. This is a very important topic. Pandemic has brought so many changes in our life. So, media is one of the most exposed part. It has both sides. So, here we have Dr. Pavitra K.S., consultant psychiatrist, Bharatanatyam exponent, a powerful orator, and a famous writer. She heads the Department of Psychiatry at BMCH Chitradurga and continues practicing at Simoha, authored 48 books in Canada, and pioneer in the field of creativity and mental health in India. She is also a recipient of many prestigious awards and received a UNICEF Media Fellowship. Over to Dr. Pavitra.
Yeah. Good evening, everybody, and I would request the audience to be seated. Though media during the pandemic and impact on mental health is probably a very important topic, which is not only relevant to our patients, but to each one of us. Because I think media during the pandemic has taught us new lessons, given new insights to us. And I think that media has come into our lives suddenly, escalated multiple things we do. So I think it only refers to our patients' mental health, because most of the topics, whenever we speak in terms of how relevant it is to our patients or how to protect ourselves from patients' complaints. But here is a topic which directly applies to even us as human beings. So I would think that this is a very thought-provoking topic which was thought over by the organizers. And I thank my chairpersons, Dr. Savita Malhotra, who is a very well-known personality, and Dr. Indumati too. As a personal experience, Madurai, the Athens of East, is a very close city for me because I started off my residency in psychiatry as a young postgraduate here from All India Entrance. So it's first alma mater for me, and after that I took my MD seat in Nimhans, and I went over to Nimhans to complete my MD. So when I look at the media and the role media plays in all our lives, and especially during this pandemic, I remember two Zen stories to break the monotony of speeches as well as to make people little more interested in talks. I've taken two short stories, Zen stories. The first one being the importance of fear. There was a monastery on a mountain, and from the forest, deers used to come, and the monks used to feed the deers and pet it. And then one day, when monks were feeding the deers, very cute little deers, then abbot, the main monk, the head monk, the abbot came, and he shooed away the deers and said, he put up a notice saying that whatever wild animal comes here, whatever deers come, you're not supposed to feed them, you're not supposed to show them any kind of passion, you just have to shoot them away, frighten them away. So then the monks got surprised, and the disciples asked the master, we are here to learn compassion, we are here to learn what is humanity, and you are such an innocent animal, you are asking us to frighten those animals. What is the reason? Isn't this wrong? And then the head monk, the abbot, said, see, this deer is going to go into the forest where there are wild animals, there are hunters who will come to hunt this deer. And then, in case it doesn't have any fear, the chances of survival is minimal. So, don't snatch away the fear. So, the protective, as a protective instinct, fear must be preserved in all these animals. So, this is about the importance of the instinct of fear. The second story is danger of fear. One day, one night, there was a village again in the mountains. So, a Buddhist monk was sitting outside the village, and he saw an angel of plague, entering the village. And he stopped her and asked her, how many lives are you going to take? And the angel answered, this time it's going to be 500. Okay, so he was waiting. By the morning, the angel came out, and he saw that 5,000 people were dead in the village. Then he asked the angel of death, what is the reason? You told me that you promised me that you are going to take only 500 lives. And now I see that, 5,000 people are dead. So where did your promise go? And the angel of plague, she answered, angel of death, angel of plague, she answered, see, I took only 500 lives. But look there, who was there besides the angel of plague, angel of death? There was angel of fear. So, I took, as the angel of plague, I took only 500 lives. But the other remaining people died because of fear. So, why I have taken these two stories is not just to break the monotony of the talk, but to show that how media can raise awareness, can raise some amount of, instill some amount of fear about a pandemic or any crisis, and can encourage health behaviors. At the same time, how it can cause unnecessary, unwarranted fear and can increase ill health, not only mental illness, but any kind of ill health. So this is a very famous saying by Jim Morrison: whoever controls the media controls the mind. And it is more true that in these days than the past. So for my presentation, whenever I get invited for a talk, since I'm into private practice, I'm into multiple different fields. I always, whenever I get invited for a talk, whether the audience comment about it or not, I always ask myself a question as to what eligibility I have to give this talk. Whether it's a small gathering, or it's a big gathering, or it's a national conference, international conference, or a local talk for lay people, I always make it a conscious attempt to ask myself what eligibility I have. And when I searched eligibility for this talk, I found these. Number one is clinical experiences as a psychiatrist, active role in the media as a writer and resource person, because I'm actively involved in media, different kinds of media, now digital media, of course. Research papers are the sources of information for these kind of presentations, though I might not have done publication papers, but I have gone through vast research papers during this particular period pertaining to media and mental health, and of course media reports. As a voracious reader, I get around 10 newspapers to my home daily. Apart from that, I read different sources. So that is my eligibility as a speaker for this particular topic. So I would like to, since I'm a clinician, so I always believe that whatever work we do, it should be clinically important. So the obsessive fear of contracting disease. Now, this was a 45-year-old lady diagnosed as obsessive compulsive disorder who was lost for follow-up, came back with obsessive ruminative thoughts about contracting COVID-19. And she described fear of seeing many types of media, which always spoke of how terrible COVID is. In Kannada channels, I'm sure in Tamil also it might be. It is never told this plain as COVID-19. It is always said Corona Mahamari, Corona Rana Ranga. These kind of terminologies are used, which always spoke how terrible COVID is. She detested seeing hospital scenes, deaths, crying relatives continuously on media. Any channel you change, these scenes would come again and again. This was first case. The second case scenario is that a troubled mother came with her 12-year-old son who refused to do anything except being online. The mother was helpless since she had to give her mobile to him for online classes. Now, till now, parents had, had a stance saying that, now this is not for you. The kids below 16 are not supposed to use mobile phones. But now, kids would say, my online class is there. So, suppose if you don't give me mobile, I'm not going to attend the class. So, she was helpless because she had to give her mobile for him for online classes. And of late, there were complaints from school about the child posting pornographic clippings. Mind you, this is 12-year-old child from the YouTube into the online classes. Case 3, this was, I was scared. It's all over the news. My WhatsApp is clogged with advices to take this important medicine to stay safe. I wanted to save my father. I just wanted to give this medicine. This was son of a senior citizen who had a cardiac arrest after taking HCQ at Shumoga. This is a real instance. This is, I'm sure many of you would have seen on your WhatsApp chats last year. we also made a media representation for this because an alcoholic committed suicide since he couldn't get alcohol. As if, it was the fault of the government not, releasing alcohol in the lockdown. And WhatsApp circulated message showing a doctor's prescription about prescribing brandy, soda, and roasted peanuts. This actually, is available now on Google, and it circulated very widely in WhatsApp communications. This is the fifth case. Goyal et al. Reported a case of suicide due to fear of contracting COVID-19 infection. Now, this subject had witnessed a few videos on the social media on the death of suspected COVID-19 cases. Later, when a local doctor diagnosed him to be infected with some unknown viral infection, not COVID, later it turned out to be non-COVID actually. He wrongly assumed it to be COVID-19 due to the fear of infecting COVID-19 to his family members, including a child. He quarantined himself and later died due to hanging. Now, I'm not saying that, Papageno effect or Werther's effect, all those things, I'm not saying that this is directly related to media, but what I'm saying is I'm just drawing your attention to how media has some role in all these cases. So when we look at media and mind interactions, now what we are going to do, the infodemic or mental health pandemic, because we are heading towards a mental health pandemic. We are not actually worried about that. We are worried about whether COVID can recur, whether the third wave will come. A lot of people come and ask questions like this, even to psychiatrists. So what are we going to do in next, I think I might have around 15 minutes at least? Yeah, 20 minutes, yeah. So media and mind interactions, pandemics and mental health, because pandemic, as we all have seen, that pandemic itself can get lot of stress on different mental health areas. People with mental illness and media in times of pandemic, like the first case scenario, what I said, that, a pre-existing obsessive compulsive disorder wherein the media portrayal increased her obsessions. Issues with child and adolescent mental health, I think separate 3-day CME can be held on these issues because it is too big, vast area. Social media advantages and challenges for mental health. Media for betterment of mental health during pandemics, and of course, media literacy and responsibility. So, how does, I would like to skip some slides because I don't think we can have a total 1 hour this thing, but still, these are the various ways through which we communicate in society. So, that's where media stems from actual mind. So, media's target is the consumer's mind. So, media always targets the person whoever reads or writes or, he changes his behavior. So, that is through his mind. So, all the, whether it is just talking, while talking, my idea is to reach your mind. So, finally, whether it is public speaking or writing or journalism or any kind of digital media, it's finally it is directly related to the reader's or user's mind. And of course, though, actually I was, when I got this message, communication that media and mental health during pandemic, you need to speak on this, I was surprised because usually for these kind of topics, either media and mind, these kind of topics, people do not make it a conscious attempt to include it in the CMEs. It is usually you have to put an abstract and get it selected for the presentation. So that is, but the one thing is sure that media matters and mind too matters. The media personnel also need to realize this. We too, mental health professionals, also need to pay attention to how media has been portraying not only mental illness but normal issues, daily news. Because media is considered, as you all know, to be the fourth pillar of democracy. And it's a very powerful tool because Suppose if I educate a patient, one-to-one person communication, now that is only one person you can reach through. But with media, if make a statement about schizophrenia or mental illness or something about rehabilitation, you can reach millions of people. In social media, it is even more wider. So global health threats like COVID-19 also are not new. Though COVID pandemic is a relatively, for us, it is a new scenario, but again, for globally, if you look at, there are such pandemics have been there in the past, and pandemics can modify human behavior greatly. If we look at just like historical aspect, we just through interest, if we look, Jack London's work, The Scarlet Fever, is a reflection on the role of media during pandemics that is mentioned in this particular novel. If you just read that novel, you can yourself look at paragraphs where media's role is highlighted there. There is an excellent paper which has come about how media, mind and pandemic can play a role in this. So the man who sent the news, the wireless operator, was alone with his instrument on the top of a lofty building. He was the hero. So the actual role of media here seems to be positive. The newspaper man is looked like a hero who is working in times of crisis. Now we give title like Corona Warriors. The similar way, the media personnel are looked at as heroes. But in modern times, the media are generally accused of exaggerating whatever little information, risks of epidemic, or contributing to public misunderstandings. But now what we need to know is that the time which is needed to analyze, assess and communicate the information has got greatly reduced, especially in times of digital media, especially so in times of COVID. So the instantaneous spreading of misinformation is huge. Now, accepting statements that reinforce our established views and to downplay statements that counter these views. And media multitasking is very routine today. Now, all of us might have two screens, a laptop on your lap and simultaneously handling a mobile, or sending from mobile a WhatsApp message and simultaneously sending an email from our laptop. This is very, very common. And maybe if you're at home, you might have a third bigger screen of TV. You might be watching news, you might be working on laptop, simultaneously handling a mobile. So the media multitasking also is very, very common now, routine now. And so you will be simultaneously managing information, sharing information from multiple sources. So it is even more challenging. So now earlier, why we have to really focus on media now is that earlier, for either for psychiatrists or doctors or anybody, media used to be third person. We could have blamed them like anything, media people hype everything, they portray wrongly, they show suicides, unedited, portrayals of cruelty, violence. All these things were, we used to blame on third person media. So it was very routine, easy to blame media as senseless, irresponsible, money making, or you just worry about the TRP ratings. But now media has shifted from third person to first person. Who is media now? Who is social media now? It is us. I will be receiving one WhatsApp, then if I don't check, I immediately forward it. I immediately share it to my groups. Or I might be just going Facebook Live and saying that, I'm doing a program on mental health. So this is very, very possible. So any of us can be media personnel now. So your own room, your own consultation room can become a studio. You don't have to, it can go without any censor. So now that scenario, we all can post our health programs, FB posts, videos, we need to ask a question to ourselves: how responsible are we? How much responsibility as clinicians we take in actually doing these health programs, or just sharing whatever message comes? Because you can keep seeing in WhatsApp different messages about somebody requiring blood, somebody requiring immediate help. So people share all these things, and whenever you derive some pleasure, whenever you derive some wonder out of that message, you feel like sharing. So as clinicians, psychiatrists, responsible citizens, how much efforts we put in correcting the misinformation, disseminating the correct information. So I have seen here 3 different perspectives as related to media and mental health during pandemic. The first is information related to COVID and how was it portrayed on the media and its impact on mental health. That is the first perspective. Second is increased media use in terms of lockdowns, restricted entertainment facilities, closed theaters. So how is increased media use during COVID, with what new challenges it has posed to our mental health? The third one is existing mental health problems and media. So the first instance where OCD and that kind of thing, positive and negative sides. So the lack of education resulting in the fear of unknown or unfamiliar and unexpected uncertainty leads to a lot of stress and the fear of infection itself. Whether if I get COVID, what will happen? If I have to be quarantined, then if something happens at home, what will I do? This uncertainty. And when we don't have adequate information, because this was more seen during the first wave when we didn't have much information about COVID. So that is the time when we, have to do sudden changes in the routine activities, restriction of movement, or reduced interpersonal or emotional support because of not able to connect socially, or separation from loved ones, because a lot of people in abroad have not been able to come to India at all. And for lots of Indians, they say that we might be speaking over the phone, we might be speaking over the Skype, we might be doing video calls, but then it is not the same as meeting people in person. Or economic problems and shortage of household commodities, medicines, safety of the family, especially children and aged. All these things are going to pose challenges to our mental health during the pandemics. The other important thing is, lots of times when we say social distancing, people used to correct us, saying that it is not social distancing, it should be told as physical distancing, because we can still connect through media. But then, I think social distancing used to mean to us earlier as, physical distancing itself, because you might have connected through phone calls, you might have connected through chats or whatever. Now, there is a difference between now seeing a speaker here and interacting, rather than speaking seeing the speaker on screen. And so that, I think, is very important, that to some extent social distancing and physical distancing are one and the same probably. So information related to COVID and how was it portrayed in the media is the degree of media panic. There are instances where you suddenly look at the TV and it keeps, going over again and again in your mind. The instances of, HCQ non-prescriptive use, drinking of disinfectants, or subsequent blindness deaths, various herbal remedies, hoarding of oxygen cylinders. All these things have been seen. Now, today a senior colleague was drinking hot water, and I asked him, actually, during COVID times, have you started using only hot water? Now, this is one of the instances where you actually, the message gets circulated about remedies, all these things. Misinformation. The misinformation is the propagation of the redundant information and the panic-prompted reactions that were out of proportion to the risk posed by the disease. This has been documented in the research during the earlier SARS outbreak. So media coverage can directly affect the public risk perceptions, and studies have shown that the media triggered public concern may affect health related personal measures taken during the pandemics. This is, it can be seen even if you don't read any studies, you just look around and I'm sure you will realize that, you know, people might say, it's okay, haldi is very good for health, it is going to be protective towards COVID. So let us take what is there. So they will continue taking haldi. So the actual media statement about these things is going to affect your mind and change the behavior. So it is possible. There is a very excellent paper by I think Debanjan Banerjee and Rao. I've given the reference list. You can go through that paper. It's very good. It speaks about how psychological perspectives behind misinformation actually encourage people to share that misinformation and help spreading of this particular these kind of misinformations. So the crisis communication itself can be three-folded, because the crisis communication needs to be balanced, fact-based and truth-oriented, but it can have other two dimensions too: biases and misleading, false and dishonest. Now, why we need to worry about misinformations and these crisis communication is that even after the COVID is over, the chances that the fear and panic generated by this particular pandemic can have a long-lasting effect on people's mental health, and it can outlive the COVID-19 media cycles. So how to counteract misinformation? Now this information is not only for our patients or clients, or when you speak publicly, definitely you can use it, but I insist that you all try this first yourselves. Now, right now, whoever has a mobile in your hands, you will be busy, forwarding something. But you make sure that take 20 seconds. It's just 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, like that 20 seconds. Take 20 seconds before reacting. Do not spread information about cures. Beware posts that traffic in fear. Suddenly a lockdown is announced. So tomorrow buy immediately, all the shops will be closed, no milk will be available. So immediately, forwarding that in a hurry. Beware that such posts which traffic in fear need not be shared immediately. Don't trust everything you see, because digital media is now, they are very, very technically very powerful. You can change anything and everything. Don't join the crowd. You don't have to join the crowd in sharing. Keep partisan politics out of it. This is important, because whether the certain political party makes oxygen cylinders available or not, those things will definitely play a role. Uncertainty sucks, get used to it, because we are not certain what will happen tomorrow. So by that anxiety, if you go on continuing, then that's a problem. So all these, there are lots of studies which are with how to counteract misinformation. So Facebook, Twitter, all these, social media companies, they have been using accuracy checks. There are different kind of fact checks, nudge interventions. So for example, now content rated false is usually downgraded so that lesser and lesser people can see it. So such things are happening. All these information probably will not, if you just look at the publication research papers, it will not be available. You need to look at broader areas. You need to just Google, use your different kind of, magazines, all those sources. If you read, I'm sure you will find a lot of information on how social media fact checks, accuracy, nudge interventions are happening. So these are happening now. We just, forward messages about how Chinese virus was probably biological weaponry or terrorism, but we don't look at how Chinese handled media then. The avoiding potential mental health issues through updates tailored to the public needs, enhanced relevancy, dissemination via traditional and social media outlets. Now, this is going to be important because WHO now has been active through all Twitter, Facebook, everything, presented by key health and government officials to boost message credibility. Now, these have happened in Chinese, Irish, Finnish, and Norwegian governments. Now, we need to look at these examples rather than just, believing the WhatsApp informations. The media research, through the media research, one more important thing we need to pay attention to, the educational interventions for healthcare personnel, not regarding COVID, but regarding the disease in question, as well as about the media handling of these questions is going to be important. Now, all of us might be knowledgeable about what to do when the patient comes, but how you are going to portray that in the media is going to play a key role, because if you don't give the correct information, somebody else is going to give the misinformation, and then larger and larger masses are going to believe that. So the second question of neglect of mental health issues in media is that we have seen that, the suicides portrayal in media has always been quite faulty. So WHO has come out with guidelines, suicide reporting guidelines. The Indian guidelines also are present now. But what needs to be done is, even during the times of pandemic, suicide reporting was very, very, portrayed very wrongly. For example, I told about substance use, substance withdrawal causing suicidal tendencies was portrayed in media as if, if you don't drink, then you will commit suicide. So those things need to be paid attention to, and we need to do more and more media awareness programs ourselves. Mental health challenges, when we look at media resources into issues that matter to individual lives and livelihoods need to be done. Because media is, as I said, it is probably only the connection between the society and between different people in the society. So now, taking apart the sensational reports, TRP sales, fuel infodemics, but they have limited benefits to mental health. Whereas if you use media in a positive way, it can have large impact on the positive mental health. As I said, this particular issues with child and adolescent mental health is, I think, is a very vast area. But I put some points, and I'm not going to dwell into each point. The earlier concerns about rising reliance on the technology has always been there, but it is aggravated during this particular pandemic time, and online schooling also complicated this issue. As I said earlier, children were prevented from using the mobile, saying that, you don't require that. Now, we had to voluntarily, give the child the mobile. Uncontrolled screen time, bigger to smaller screens. Earlier it was used to be TV. Now, if a child is brought to you, you ask how much does she or he watch TV excessively. Parents say, no, he doesn't watch TV. Then if you take it that, the child doesn't have any entertainment, it is wrong, because the child has total continuous entertainment. Also, decline in reading and writing habits, obesity. Obesity was one of the very, very important concerns. The social media, of course, social media and adolescence. Social media has been a double-edged sword, but I think sharper on both the edges. So it is going to be a real enigmatic area as to how to handle social media. Do I have 5 minutes? Yeah, fine. So social media amplification, late bedtime, wake time, sleep problems, obesity and related comorbidities. Again, in terms of pandemic, community studies have shown that the immunity is linked to sleep, and sleep decrease in the sleep time, again linked to reduced immunity for pandemics. I mean, any kind of infectious disorder. So, media multitasking again is very common in younger generation, adolescents. Problematic internet use, so compulsive checking, asking increased nomophobia, fear of being without a mobile phone. It's almost like, their life is gone. So mobile is not there, I can't live. That kind of scenario, more seen in adolescents. Narrow standards of beauty, highly edited images, endless scrolls. They keep on scrolling. So pandemic leading to social isolation, leading to smartphone and internet addiction. So these things I'm going to skip. Last thing, what I'm going to speak on next 2-3 minutes is that psychiatrist's active role in the media is, I think, is the most important thing. Now we all, if a media person calls us up, then we might answer questions, or if they request, we might write an article, or we might, if somebody calls us for a webinar, we might be able to speak on a topic. But this is the time when a psychiatrist needs to think that reaching masses through various types of media is going to be part of his clinical responsibility. So we need to think, corporate social responsibility, CSR, we know. All corporate firms have some social responsibility. So they contribute some money towards some kind of social event. But we never speak of clinical social responsibility. So as a clinician, I practice, I see my patients, I teach my postgraduates. Is that it? No, I need to take an active role. I need to say, I need to reach the public media, mass media. I need to reach public in some ways so that I disseminate the correct information about health, correct information about mental health. And then only we can blame others, whoever is spreading the misinformation. Otherwise, I think it will be, the part of responsibility we have not managed. And then we say that, somebody else is doing, media is irresponsible. I think it is not right. So with this, in times of pandemics, media can play a crucial role. Simple behavior changes and mindfulness can be done through good media information. Routine personal health care can become less accessible to general public during the pandemic, wherein media can step in and actually make care much easier. So media matters, but mind matters too. So for me, media personnel, we might say this, but for us, we need to realize that media matters too. So as clinicians, as psychiatrists, we can never say, this media and mental health is not my topic. This is a fringe area of psychiatry, so let me go and sit for only neurobiological sessions or OCD session or another session. No, we need to learn how to handle media because it has a great impact on mental health. Thank you. Yeah.
Hello, yes. Thank you very much, Dr. Pavitra. Please come here and join us for this excellent coverage of the topic. You described the role of media, how it can actually serve as an agent, media as an agent of mind-altering power that it has, and then in this current COVID crisis, how media played different kinds of roles, and from positive to negative to extremely negative, and how it affected mental health in different ways. Mental health of patients who already had mental illness, mental health of people who are vulnerable, who are little highly more anxious and more cautious in their life, and how they reacted to media reporting, and then of course normal people, how they reacted to media reporting. And media on one hand, as Dr. Pavitra has said, is positive. It gives information, but also on the other hand, it can have a negative, it is double-edged kind of a sword, can have negative impact when the media reporting is either misinformed or sensationalized, exaggerated, or and many times this is not even in the best interest of public, and many times we have also seen it's politicized. There are other factors that influence media reporting, and sometimes it is done in a very insensitive way. In COVID time, we know in the first wave, initially when the COVID breakdown occurred, there was so much of anxiety and fear generated by media reporting that as if this COVID is a Mahamari. Of course, it was called Mahamari, and that you can get it by simply looking at a person or just standing next to a person. It was something like the fear that was generated when the AIDS broke out. So similarly, it happened. But over a period of time, in 6, 8 months, 10 months, that kind of anxiety reaction settled down. And then, of course, the media reporting of the management of COVID cases in hospitals, at homes, in mortuaries, and this, that. I think there was a great deal of irresponsible reporting that occurred, and which caused a great amount of anguish, fear, pain in public. So these are the different facets about media and mental health. With this, I would like to now open the talk for discussion. Would like to invite questions and comments, if any, from the audience, please. Anybody would like to ask or share something on this topic? It's a very general topic. All of us would have opinion and experience.
Hello. Hello. It's not a question, it's just a comment. Actually, in the earlier days, few years back, Indian Psychiatrist Society has given some guidelines, media guidelines with respect to the reporting of various, it could be a suicide or something like that. In the same way, of course, as Madam has clearly told that it is a double-edged sword. Sometimes it is beneficial, sometimes it may not be harm to the public also, but as well as a very good tool to create an awareness activities also. So definitely the societies, various professional bodies should come up with guidelines. What should be there? Even we can even suggest to the courses in the journalism courses where the people, the media persons will come out of that. The UGC also we can suggest something like media guidelines with respect to the depicting the issues related to the health aspect. It could be a mental health or anything else.
Actually, the Masters in Communication and Journalism has a small chapter in one of the papers. There are 5 papers in mass communication and journalism. In one of the papers, there exists already a chapter on mental health reporting, but it is not. It is like, how psychiatry is depicted in our MBBS earlier when we used to get trained. It used the responsibility is on us rather than saying that they should include psychiatry as one of the mental health as one of their papers. So there exists already, maybe emphasis on that being taught properly, or 1 hour of some sensitivity by psychiatrists is going to do the job.
Yeah, like morning session, we have a prize for the question also, but lack of time, 1 or 2 questions are allowed.
I think, Dr. Somashekar, your point is well taken. We as body of psychiatrists should and try to create this kind of awareness and maybe prepare guidelines in general about mental health issues and how media should be reporting. Dr. Mohan Raj.
Ma'am, in Chennai, there are a lot of media colleges, outlets, and SCARF and other agencies, IPS, have been doing regular interactions we have been training students of journalism. I also occasionally teach in Asian College of Journalism. This was so what happens is what they tell us is they are aware of these guidelines. Apart from our psychiatrists giving guidelines, media has a guideline of what word to use, what word not to use when reporting suicide. All these are there in a document. But the problem is they say that your efficiency as a reporter is considered or the desk is considered based on who reported this first. Is it our paper or some other paper? So there is a race to go under a particular time. So something happens, they just write. It could be a person in his first year, and there is no time when you are trying to beat the other newspaper to go back and check whether everything is in order, have they said the words properly and all. So they say a lot of stuff happens because it's all hurry, and the desk will just, they know that other newspapers haven't covered it, so they will just pass it on to say that we are the first one. They say if they are first of the block with the news, they get much more clicks than others. Now what we could do is, we know this is what is happening. They said all these guidelines are there. They agreed to all that. What we could do is, since it's all online, it's not come in the print paper next day, if you see some objectionable word or the way they have written, you can always get across, send an email or do. They actually appreciate it, they correct it. This is in websites. Now in YouTube, if you see anything objectionable in terms of words used or content, there are these 3 dots where you can say report and say exactly what you want, what you think. And either YouTube will tell the maker to correct it, or if it's too much for it to correct, YouTube just stops it until the person does it again, which is very, very powerful, which is a feedback which we can give. And in the print media, they appreciate it a lot. If you write to them saying, this is reported like this, can you change it? These are the guidelines, immediately they do.
I think you've flagged very important issues. One, of course, the first one, that the media houses, they cannot absolve themselves of the responsibility in their hurry to report first, go first. So we cannot give them a clean sheet saying that it's okay, you have done a mistake. No. And second, also is true that if whenever we come across anything irresponsible or wrong reporting or usage of words, we as a body of psychiatrists or individual in our own individual capacity should proactively kind of take it up. So it's a responsibility on both sides. They need to be more careful, and we need to be also vigilant and checking as soon as we come across anything like this. I think this is something, and of course there will be a need for a constant two-way dialogue and for creating awareness and so on. So I don't know, the laws are also there, but we are not reaching up to that level at the moment. Yeah. There was a beep about the timer. It has given us a beep about time is up. With this online audience, did we have anything from the online, please? No? No?
You don't have any questions online, ma'am?
No questions online. No. And so with this, we would like to thank Dr. K.S. Pavitra for this excellent talk and very informative and comprehensive coverage of this subject. And thank you all the audience for your patient listening and being with us. And thank you, Indumati, for being my co-chair. And thank you very much. Thanks to organizers. Thank you.
Thank you, ma'am. It was a captivating session. And now I invite the chairpersons to hand over the memento to Dr. K.S. Pavitra. Thank you, ma'am. I welcome Dr. Rajaram to honor the chairpersons.